At Bellarine Community Health, there was an issue highlighted by the dietitians within the organisation, that their current nutritional education material was not engaging their patients, in particular parents with young children. So a needs assessment was carried out to determine the preferred methods of receiving health information within this target group, with the aim of developing a new resource that would assist dietitians to better disseminate nutrition education. A stakeholder matrix was created, which was plotted against two variables: the level of stake in the issue of developing resource and the amount of resource they can offer. In particular, for the purpose of the needs assessment, the stakeholders that were involved was BCH, local preschools, and collaborations with dietitians and other allied health staff. To gather the appropriate data, a survey was created. This survey was handed out at 3 different preschools, in which I would ask parents to fill out while they waited to pick up their children. I also sent out an email to all Bellarine Community Health staff asking any parents with young children to fill out the survey via SurveyMonkey. A group of 10 new mothers attended a focus group to discuss their opinions on what were the best ways for them to receive nutrition education. Following a focus group agenda, it acted as a guide to promote discussion within the group. Posters were used to advertise the focus group and incentives were indicated.
Much of the project is we're trying to work out the best ways for parents to receive nutrition information.
Based on the results, email was the most preferred method, followed by paper, then websites. And the biggest influences for participation decisions was time, cost, and format. Some recommendations that have come from this needs assessment include to create a template for communicating nutrition education via email that is easily accessible for the dietitians, and a review of the current written information is also suggested to ensure that it's up to date and appropriate in terms of format and level of health literacy. The results from the needs assessment will be disseminated to the relevant stakeholders. This includes sending an email to the dietitians at Bellarine Community Health, as well as all other allied health staff about the findings and conclusions, discussing findings of research at the next Bellarine staff meeting, and to email the results to the other stakeholders, such as the preschools, Drysdale, Port Arlington and Beacon Point. The overall goal of this project was to improve and develop nutrition education resources for the dissemination by dietitians to parents with young children. By creating resources that are more effective at educating this target group, the aim will be to improve knowledge, attitudes, self-efficacy, and individual capacity for change. This will assist parents with young children to make healthier food choices for themselves and their family, which could potentially improve their overall health outcomes.